Okay, so you've had ACL surgery. Now what? What happens after ACL surgery? This is Dr. P. We're talking about knees. Remember, if you got a problem with your knee, call Dr. P. What we're here to talk about today is really more what happens after you've had the ACL surgery. What's the recovery like? How long does it take to get back to getting back to do what you want to do, your normal daily activities, your job? And for many/most people who get ACL reconstructions or ACL repairs, it's when can I get back playing my sport again? So it depends on what type of ACL surgery that you've had. So there are really two main types. There's a thing called BEAR surgery. BEAR stands for Bridge Enhanced ACL Restoration. And the main type that's most common currently is called an ACL reconstruction. So reconstruction means we're making a new one. It's not a repair. For the first 2 weeks, both surgeries aren't going to go too crazy with the strengthening. After the first 2 weeks of an ACL reconstruction, a lot of times we can get the patient off their crutches and sometimes even out of their brace. Well, at least we'll start weaning them off of that as long as they have good quad control. The quad is that muscle on the front of your thigh, and that's really important for both surgeries. You really want to get that strong. So that's what the therapist is going to work on. And once they get that strong, same thing even with the ACL repair, the BEAR surgery, maybe at the 4-week point is when you can start weaning off the crutches. Usually by 6 weeks, we can unlock the brace for the patient to walk, but they still have the brace on. So once we get to the 8-week point, both surgeries are about the same. So the bottom line is in the first 8 weeks, the repair surgery is going to be a little slower. And after that first 8 weeks, now we're far enough along with the repair surgery that we've caught up to where the reconstruction surgery is, and now you can start working on more advanced strengthening exercises, but not crazy stuff like running, jumping, none of that stuff. You don't want to overstress it, but more advanced strengthening exercises. Things like squats, start with double leg squats and then maybe move up to single leg squats eventually. Leg press is a good one. That's another one that they'll work on. Start riding a bike. And so really making sure we get all that range of motion back, make sure our gait, we're walking normally, we have good quad control. Also what we'll work on is what we call proprioception, which is like joint position sense, training your brain to know where that knee is in space. And that actually is much better preserved with the repair surgery because you're preserving all those nerves than it is with the reconstructive surgery. So it takes a lot more time and effort to get that proprioception, that position sense back with a reconstruction. And it never really comes back fully, whereas with the repair, it does tend to come back more fully and the knee feels more normal. So those proprioceptive or position sense or what we call dynamic stabilization exercises, stabilizing that knee while the patient is moving or while the surface is moving is really important because eventually you're going to be running, cutting, jumping, doing all these things that are not on stable surfaces, or you're going to be moving and running and cutting, and your knee has to start to get used to that. So they start the early process of that, usually after the first 6 to 8 weeks. If you have any questions or comments, please feel free to put those in the comment section. We'd like a thumbs up if you can give us that, and please subscribe to our channel. And we look forward to giving you more educational videos, and stay tuned.